Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Here to talk about the medication Fexofenadine, kind of an overview of the medication. We'll discuss uses, dosage, as well as the side effects. As with all my videos, informational purposes only. Full disclaimer available in the video description. So Fexofenadine, what it is, it's a second generation antihistamine. Many people just say allergy medicine. It's my allergy medication. In the U.S., sold under the brand name Allegra. It's used to treat generally upper respiratory allergies. So those are your symptoms, including like runny nose, sneezing, itchy nose and throat, itchy, watery eyes. Sometimes we see it off-label used for hives. Dosage, tablets are available in 60 and 180 milligram tablets. There's a syrup available. It has 30 milligrams in each 5 ml or 30 milligrams per teaspoon. Children 2 to 11 generally dosed at 30 milligrams twice a day with a max dose of 60 milligrams. Always be certain that you read the label to ensure that you know the correct dosing. And adults and children over 12 can take the 60 milligram tablets twice a day or 180 milligram tablet once a day. The Fexofenadine, best taken with water, and it is best to avoid grapefruit juice and fruit juice for 4 hours, either before or after taking Fexofenadine. Could reduce the amount of Fexofenadine absorbed into the system by a third, so it's best to avoid taking it with fruit juice. Some of the side effects, very few. Most of these second generation antihistamines tolerated really well. Typically people don't have a lot of problem with them. We see side effects in less than 5% is generally what it's reported. Some of the most common side effects including headache, fatigue, and drowsiness. Now, these second generation antihistamines are usually marketed as non-drowsy antihistamines, and for the majority of people they are. But some people may experience drowsiness, but it is not common. And nausea and vomiting can occur as well. Interesting thing, Fexofenadine is an active metabolite of terfenadine, which was sold under the brand name Seldane. I do remember taking that back in the 1990s. It's no longer on the market, but Seldane and Seldane-D were a very popular product, and Fexofenadine is actually what the body converted the Seldane into. So it was just an interesting side note. Peak effect usually within 2 hours. So often people notice improvement within that first hour, but that peak effect generally 2 hours after taking your dose. It does tend to last 24 hours. And it's best to avoid alcohol with antihistamines as it increases the risk of drowsiness and other side effects. It is available in a combination product in the U.S. called Allegra-D, typically going to be sold behind the counter in the pharmacy. Some states, I believe, even require a prescription for it. What it does, it has that added decongestant, pseudoephedrine. Pseudoephedrine, or what many people refer to as the Sudafed, the brand name pseudoephedrine. It, coupled with the antihistamine, can work really well to relieve symptoms, especially if you're having some difficulty breathing. If your nasal passages are swollen, the decongestant pseudoephedrine can improve sinus and nasal drainage and improve your nasal breathing and reduce sinus pressure. So the two products together is very popular. Appreciate you watching. Please like and subscribe.